Viral gastroenteritis is often called the stomach flu, but it's not actually the flu. It is an infection that causes inflammation in the stomach and intestines, leading to a range of uncomfortable symptoms. This inflammation can result in severe stomach pain and discomfort. This common illness can make you feel very sick, often confining you to bed. It can cause vomiting, diarrhea, and stomach cramps, which can be quite debilitating. Viral gastroenteritis is very contagious, meaning it spreads easily from person to person. This means it can quickly move through households, schools, and other close contact environments. It is important to take steps to prevent its spread, especially in places like schools and daycare centers where children are in close contact. While uncomfortable, the good news is that most people recover quickly, usually within a few days. However, the virus that causes gastroenteritis can be serious for infants and young children. This is because they can get dehydrated very quickly, which can lead to more severe health issues. It's important to make sure they drink plenty of fluids to stay hydrated and help their recovery. If you are concerned about a child, always talk to your doctor to get the best advice and treatment options. Viral gastroenteritis usually starts suddenly. You might feel fine one minute and then sick to your stomach the next. The most common symptoms are nausea, vomiting, diarrhea, and stomach cramps. Other symptoms can include a low-grade fever, headache, chills, and muscle aches. These symptoms can last from a few hours to several days. Most people start to feel better within a day or two. If you are experiencing severe vomiting or diarrhea, it is important to stay hydrated. Drink plenty of fluids like water, clear broth, or sports drinks. These can help replace the fluids you lose. Several different viruses can cause viral gastroenteritis. The most common culprits are Norovirus, Rotavirus, Adenovirus, and Astrovirus. Norovirus is the leading cause of gastroenteritis in the United States. It is highly contagious and can spread quickly in closed spaces. Rotavirus is another common cause, especially in infants and young children. Adenovirus and Astrovirus are less common causes of gastroenteritis, but they can still make people sick. These viruses can live on surfaces for long periods, which is why good hygiene is so important. Section 4. How gastroenteritis spreads. Viral gastroenteritis spreads easily through close contact with an infected person. This means that if someone who is infected is near you, the virus can be transmitted quite effortlessly. This can happen when an infected person coughs or sneezes near you, releasing tiny droplets that contain the virus into the air. It can also spread through contaminated food and water. Consuming food or drinks that have been handled by someone with the virus can lead to infection. Touching contaminated surfaces and then touching your mouth, nose, or eyes can also spread the virus. Everyday objects like doorknobs, handrails, and even mobile phones can harbor the virus. This is why it's so important to wash your hands often, especially after using the bathroom and before eating. Hand washing is a simple yet effective way to remove germs. Good hygiene is the best way to prevent the spread of viral gastroenteritis. Practicing good hygiene habits can significantly reduce your risk of getting infected. Always wash your hands thoroughly with soap and water, especially after using the toilet, changing diapers, and before preparing or eating food. Proper hand washing involves scrubbing all parts of your hands for at least 20 seconds. Section 5. Diagnosis and when to see a doctor. Doctors usually diagnose viral gastroenteritis based on your symptoms such as diarrhea, vomiting, and stomach cramps. They might ask about your medical history, including any recent travel, and if you have been in contact with anyone who has been sick. They may also do a physical exam to check for signs of dehydration or other complications. In some cases, the doctor might order a stool test to identify the specific virus causing your symptoms. This is to rule out other possible causes of your symptoms, such as bacterial infections or parasites. This is more common in severe cases or when there are concerns about complications such as dehydration or prolonged illness. You should see a doctor. If your symptoms are severe, or if you have a high fever, bloody diarrhea, or severe abdominal pain, as these could indicate a more serious condition. You should also seek medical attention if you are unable to keep down fluids, as this can lead to dehydration, which requires prompt treatment. Section 6. Treatment and recovery. There is no specific treatment for viral gastroenteritis. The goal of treatment is to relieve symptoms and prevent dehydration. Most people recover at home with rest and fluids. Drink plenty of fluids to stay hydrated. Water is best, but you can also have clear broth, sports drinks, or oral rehydration solutions. Avoid sugary drinks, as these can worsen diarrhea. Get plenty of rest. Your body needs time to fight off the infection. Over-the-counter medications can help relieve symptoms. Pain relievers can reduce fever and aches, and anti-diarrheal medications can help stop diarrhea.